It's 2 a.m. Your baby is tugging their ear again. You've been Googling baby ear infection symptoms for 27 minutes, and now you're convinced something is terribly wrong. Hi. I'm Baby Leo. Before you spiral into another 3 a.m. panic spiral, take a breath. I'm going to walk you through 3 baby body language signals that parents misinterpret all the time, what they actually mean, and, most importantly, when you actually need to call the pediatrician. Here's what we're covering today. Number 1, tugging at ears. Is it an ear infection? Teething? Or just ears? Number 2, arching back during feeds. Reflux? Gas? Or something else entirely? And number 3, those tiny clenched fists that every grandparent swears means the baby is hungry. Let's start with the biggest myth. Ear pulling equals ear infection, right? Wrong. Babies pull their ears for at least 4 different reasons, and infection is actually the least common one. Here's the one that shocks most parents. When I'm teething, the pain radiates along my trigeminal nerve, straight from my jaw to my ear. It's called referred pain, and it makes me grab my ear because it feels weird, not infected. Reason number 2. I'm tired. This is actually the most common cause of ear tugging in babies between 4 and 12 months. It's a self-soothing behavior, like thumb sucking or rubbing a blanket. When you see me rub my ear, yawn, and get fussy, I'm telling you I need a nap, not an antibiotic. So when does ear pulling actually mean infection? Here's your checklist, moms and dads. Green zone, probably normal, baby pulls ear, no fever, still playful between tugs, sleeps okay. Red zone, call the pediatrician, fever at or above 100.4 degrees Fahrenheit, fluid or pus draining from the ear, crying that gets worse when lying flat, or symptoms lasting more than 2 to 3 days. And reason number 4. I literally just discovered I have ears. Babies explore their bodies in order. Hands first, that's why newborns stare at their fists. Then feet, somewhere around 4 to 5 months. Then ears. Pulling my ear might just mean I'm doing baby science. So before you panic, moms and dads, look at the whole baby, not just one body part at 2 a.m. Now let's talk about the body language signal that actually can be serious, but usually isn't. Back arching during feeding. Here's the scene, you're feeding me, everything seems fine, and suddenly, I throw my head back, stiffen my whole body like a tiny surfboard, and start screaming. Your brain immediately goes to acid reflux. And yes, the American Academy of Pediatrics does list arching the back during feeds as a potential sign of GERD. But here's what most parents don't know. Most of the time, and I mean the vast majority, it's not reflux disease. It's gas. When I have trapped gas in my immature digestive system, arching my back is how I physically try to stretch out and relieve the pressure. The giveaway. I'll scrunch my legs up, arch, pass gas, and then suddenly, relief. I calm down. That pattern, arch, scrunch, toot, calm, is classic infant gas, not GERD. Then there's colic. If I'm arching my back, crying for 3 or more hours a day, 3 or more days a week, for 3 or more weeks, and nothing you do helps, that fits the clinical definition of colic. Back arching with high-pitched crying, clenched fists, and a flushed red face is the textbook colic presentation. Colic peaks around 6 weeks and typically resolves by 3 to 4 months. It's exhausting for you, but it's not dangerous for me. So how do you tell the difference between ride it out, gas, and call the doctor, reflux? One question. Is my baby gaining weight normally? If I'm gaining weight, having plenty of wet diapers, and my spit up isn't projectile or bloody, my back arching is almost certainly just gas or normal newborn digestive adjustment. Keep me upright for 20 to 30 minutes after feeds, burp me well, and give it time. If I'm losing weight, refusing to eat, vomiting forcefully, or if my spit up looks green, yellow, or bloody, that is GERD territory. Call your pediatrician. Now for body language signal number 3, clenched fists. Someone in your life, a grandparent, an auntie, a well-meaning neighbor, has definitely told you, oh, his fists are clenched, he's still hungry. Moms and dads, I need you to hear this. Clenched fists in a baby under 4 months old have almost nothing to do with hunger. This is the Palmar grasp reflex, a primitive brainstem reflex that's been present since I was a 16-week fetus. Stroke my palm and my fingers automatically curl tight. It's an evolutionary leftover from when baby primates had to cling to their mothers. Does clenching intensify when I'm hungry? Yes, a little. When I'm hungry, my whole body tenses up, including my fists. But here's the actual hunger signal you should watch for. After feeding, when I'm full, my fists relax and open. That open hand after feeding is the true satiety cue, not the clenching itself. So stop using my fists as a hunger meter. You'll drive yourself crazy, and you might overfeed me in the process. Watch the whole baby, rooting, lip smacking, crying patterns, not just my hands. Here is your normal development timeline, parents. 0 to 3 months, fists clenched most of the time, completely normal. My corticospinal tract, the neural highway connecting my brain to my muscles, is still under construction. 3 to 4 months, the Palmar grasp reflex starts fading. You will see my hands open more, especially during sleep and calm moments. 5 to 6 months, I start reaching for toys and voluntarily grabbing objects. The primitive reflex gives way to voluntary motor control. This is a sign my brain is maturing exactly as it should. However, and this is important, if my fists are still tightly clenched past 6 months, if my thumb is always tucked in and won't relax, or if you notice stiffness in my limbs, please bring it up with your pediatrician. Persistent fisting beyond 6 months, especially with thumb in palm posture, can be a red flag for neurological conditions including spastic cerebral palsy that benefit enormously from early intervention. This is rare, but it is why pediatricians check these reflexes at every well baby visit. Let's wrap this up, moms and dads, because I know you're tired and I know baby sleep is precious. Ear tugging. Usually normal, self-discovery, teething, or tiredness. Only worry when fever, ear drainage, or inconsolable crying join the party. Back arching. Track the pattern. Arch scrunch toot calm is gas. Arching during every feed with poor weight gain is a pediatrician visit. Clenched fists. Not your hunger alarm. Watch for them to relax after feeding and gradually open between 3 and 6 months. You are doing a great job. Parenting is hard because baby body language is genuinely confusing, even doctors sometimes pause and observe. The fact that you are here, learning, trying to understand your baby, that already makes you the parent they need. Now please, go take a nap. If this video helped you understand your baby just a little bit better, please hit that like button, subscribe, and tell another exhausted parent who needs this information at 2 a.m. See you in the next one, moms and dads. Now seriously, go take that nap.